All right, hello, my name is Bronson, and this is the special test for the knee and thigh. So first we're gonna start with the Ober's test, the Ober's test for the knee. So we're gonna have him lay on his side and flex the bottom knee, just to have like stability there. And what I'm gonna do is I'm gonna have him, tell him to keep his leg straight. I'm gonna pull it out over the edge of the table here, and it goes down. So a positive test for this would be if his leg stays horizontal like this, then that is a positive test, and the associated pathology would be ITBS, iliotibial band syndrome. So that's the Ober's test for the knee. Next we got the patellar compression test. So I'm gonna have him lay on his back, supine, and if I'm looking at his right knee here, I'm gonna have him flex the muscles of the thigh here, so go ahead and flex these. And do you feel any pain? Okay, then I'm gonna take this part of my hand here, apply some pressure just above the patella, some light pressure at first, have him flex it again. Any pain? Okay, and I'm gonna keep on doing that and keep on having him flex. A positive test for this would be pain in the patella, and the associated pathology would be PF syndrome. Next, we got the patella apprehension test. So for this one, I'm gonna stand on the opposite side of the body of the leg I'm working with. So for this one, we're looking at his left knee here. And all I'm doing is grabbing the superior and inferiorly of the knee, and I'm gonna push the patella laterally. A positive test for this would be apprehension. So if this kind of makes him nervous or freaks him out a little bit, just pushing that patella, then that would be a positive test, and the associated pathology is subluxation of the patella. Next, we got we're moving up into the thigh. We're gonna do the hamstring 90-90 test. So I'm gonna have him flex his hips to 90 degrees, and have him place his hands in his knee pits there. And what I'm gonna have him do is with his, here, we'll go a little bit, 90 degrees, so 90 degrees there. And I'm gonna have him, one at a time, try and straighten his leg as much as he can. And then bring the other one up. Okay, and a positive test for this would be if he can't get less than 20 degrees from full extension, then that would be a positive test, and the associated pathology is tight hamstrings. Next, we're gonna move on to the meniscus with the Thessaly test. So I'm gonna come grab the camera here. Okay, so for the Thessaly test, I'm gonna have him balance here on the table here, or he could hold on to me if I'm available. I'm gonna have him stand on one leg and slightly bend that knee, and then he's just gonna rotate his body at the knee. Okay, and then a positive test would be any pain, and the associated pathology is with the meniscus. You didn't feel any pain, did you? Perfect. Okay. Next, we've got the McMurray's test. So I'm gonna have him lay supine on his back, and I'm gonna work over here. What I'm gonna have him do is bring his leg up. We want his knee to be in full flexion here and up in the air. And all I'm gonna do here is I'm placing my hand, I'm gonna feel this, the lateral and medial side of his knee. I'm gonna rotate his leg internally, and then extend his knee to 90 degrees, and then rotate it laterally and do the same thing. And what we're looking for here is any painful clicking. If I hear or feel any clicking and it's painful for him, that's a positive test. Associated pathology is with the meniscus. Next, we've got Apley's compression test. So I'm gonna have him lay prone on his stomach. I'm gonna bring his knee into 90 degrees of flexion, and I'm gonna apply pressure here, and then rotate internally and externally. And I'm gonna slowly apply like more and more pressure and continue to do the test. A positive test would be pain, and the associated pathology is with the meniscus. Okay, next we're gonna do the varus and valgus stress test. So I'm gonna have him lay supine on his back. So I'm gonna scoot this way a little bit. So I'm gonna grab his leg here. The varus test, so varus force is when the force goes medial to laterally. I'm grabbing his leg here. I'm just applying pressure here against his knee. A positive test would be laxity, so you have to compare this to the other side. And then the associated pathology for the varus test would be the MCL. And then for the valgus test, same thing, except for I'm applying pressure laterally to medially. And again, the positive sign for this test would be laxity, so I'd compare it to the other knee. And then the associated pathology would be the MCL. Oh, the associated pathology of the varus test is the LCL. Associated pathology of the valgus test is the MCL. Next, we've got posterior and anterior Lachman's test. So what I'm doing here is I'm grabbing his leg. And so for the anterior Lachman's test, I'm going to take my dominant hand, put it underneath, and then my non-dominant hand and put it here. And I'm trying to shift the tibia anteriorly. Positive test is laxity, so I'm comparing it to the other side. And then the associated pathology for this one would be the ACL. And then for the posterior Lachman's test, I'm doing just the opposite. So I'm trying to push the tibia posteriorly. So I'm pushing down here. And positive test is laxity, so I'm comparing it to the other side. And then the associated pathology is with the PCL. Next, we got the anterior and posterior drawer test. So I'm gonna have him flex his knee. And what I'm gonna do is kind of sit on his foot here so there's no shifting here. And so for the anterior test, I'm just grabbing his tibia, or the back of his calf right here, and I'm trying to shift the tibia anteriorly. Positive test is laxity, so I gotta compare it to the other side. And then the associated pathology for this one is the ACL again. And then for the posterior drawer test, same thing here, except for I'm pushing in, trying to shift the tibia posteriorly. Positive test is laxity, so I gotta compare it to the other side. And then the associated pathology for the posterior drawer test is the PCL. And that is all of the tests for the leg and the thigh, or the knee and the thigh.